All right. So, hello, everyone, and welcome to our next session of our STEM careers. And this time, we're going to be focusing on nursing as well as talking about some of our other programs here at NOVA that fall under our health sciences area. Yes, we're going to get into today's session. This session is focused on the career clusters in career and technical education. And this is going to be the health sciences area. And this is something that we follow in the Commonwealth of Virginia. And so with that, some of the careers are in that career path include like registered nurses, nursing, medical assistants, home health aides, medical, and health service managers. So there are a lot of different career paths, but we just kind of pull out a few. But when you do go to the VDOE, which is the Virginia Department of Education, and you look up career clusters, you can actually get more in-depth information about pay and, different careers that are kind of advancing with more people being interested in them and more at that. The other thing we like to do is we always like to include a slide that just gives you a few organizations that you might be able to connect to related to the area that we're speaking about. So today, we do have links to the NOVA clubs and organizations, and you can look through and see which things may be related to medical careers, health sciences. But we've also included some associations related to nursing and healthcare professionals that you as a student, or if you are a professional, may choose to get involved with. And so, of course, you know that your desire to work in the health sciences really has a focus on the love and the passion to really help people, keeping people healthy, and working directly and sometimes indirectly with individuals who are not feeling well. So we have three amazing individuals who are going to help us out with today's session. I'm going to give you their brief bios now, and each of them will be involved in speaking shortly. But first of all, I want to tell you a little bit about Kimberly Nicely. She is our Interim Dean of Student Services here at NOVA, and also has her MBA. And with 30 years in higher education, 25 of those years she's been at NOVA, so Northern Virginia Community College. And she has served in various roles at the college, including adjunct faculty for the School of Business, special projects for the provost, grant-funded projects, and the program manager for MEC, which is our medical education campus clinic, and then also the associate dean of students. And now she's the interim dean of students. Many of her roles have involved the health sciences and nursing programs, and she works with students seeking entrance into the HSN program. So Kimberly, thank you so much for joining us. We will remember, either Nikki or myself will try to remember to spotlight you when we have you speaking momentarily. Our next panelist that I want to introduce you all to is Iyad Abdel Latif, the Director of Nursing, with lots of letters: RN, MSN, MBA, CCRNK, and LSSGBC, which you'll have to tell us all about that alphabet soup. But his background is in Johns Hopkins School of Nursing, as well as the Carey Business School and American University of Beirut. And one of the things that we try to do for you all is we do provide the links. We will send out this presentation to everyone who registered, so you can actually connect with our panelists offline through LinkedIn or email. But Iyad has been a nurse leader with more than 20 years of acute care, clinical, and leadership experience in both national and international settings. A transformational servant leader focused on relationship building to achieve outcomes via forging multi-professional partnerships with an inclusionary mindset as people support what they help create. He was also successful in leading teams to achieve care excellence in a fast-paced healthcare environment. And he works for the UVA Community Health System. He's a healthcare leader, which is a healthcare leader, obviously, here in Virginia. And they really have a high quality network of medical care, really focused on residents in our local communities. And they do have an unmatched patient experience. It's really centered upon clinical safety and excellence at each of their three medical centers, which are great because they're kind of spread out. So that helps us to have opportunities for people as they go into the healthcare industry. But the Culpeper Medical Center, Haymarket Medical Center, and Prince William Medical Center. And they bring together leading edge technology and comforting care, all close to home for every patient, every time. So thank you so much for joining us. If you want to wave and let people know who you are.
It's my pleasure. Thank you so much for having me today.
Awesome. Thank you. And our final panelist that's joining us here today is Diana Hernandez. She's a critical care registered nurse with HCA Healthcare. Diana actually has completed the one of our programs here at Nova, and I think I actually have those letters transposed. So I think it's the ADN program actually here at Nova. She also from UVA, she's working on our BSN. So Diana, correct me if I'm wrong. That's something you're working on in progress, right?
That's correct.
Awesome. And then she's also a HCA new grad residency program and this STAR, which is, I guess, the STAR RN for critical care, which we'll have her tell us about a little bit later. Diana's experience, she's a Northern Virginia native. She has 2 kids and 2 dogs and 1 husband and lives in Burke, Virginia. And she's also a graduate of our Career and Leadership Readiness Institute, which was a optional career and leadership preparation program that we offered for Nova students from January through March of earlier this year. And so Diana was one of our participants. As I mentioned, she's working on completing her BSN through UVA and has 10 plus years experience in healthcare. And just so you all know, she started out in high school as a filing clerk at a family medical office. So it's so great to see that she went from doing the filing, working in the office to now working as a nurse in the industry. And she previously, and she's also been, involved in work with Nova. And so Diana, we are very happy to have you here and appreciate you taking your time and coming back to also speak as a former student here. So in case people have questions throughout this session, if you do have questions that you want to ask in the chat, feel free to type them, if you want them to go to everyone or to our panelists. If they're not speaking and they're able to see their chat, they may be able to respond right away. If not, we will make sure that we get those questions answered for you before the end of the session. So Nikki will help with coordinating the little chat part there with you all, as well as our panelists. So let's kick it off here. And first we're going to start with Iyad. And can you tell us a little bit about, let me make sure I spotlight you so everyone can see you. I mean, we know we see you, but we really want to see you. So hopefully you're big on the screen for folks on their end. When did you first become interested in nursing? And I know I read a little bit of your bio, but what were your experiences that got you to where you are now? Because we know you are a very busy person, and taking time to spend with our Nova students and our potential students and our team. We are so grateful to you and the rest of the panelists for your time today.
Absolutely, Tiffany. It's really a pleasure to be here with Diana. And it's just like, Diana, I can't wait to hear myself. I'm so curious to hear about your journey. But it's really been a journey for me in nursing, and started very early. And my mom was diagnosed with breast cancer when I was 8 years, and that's my first introduction to healthcare and healthcare system. That's back in Lebanon, and really kind of my passion, even though I didn't understand that well at the time, the seeing the compassion and the giving and the care that was provided to my mom, it was stuck with me. And then once I graduated, I knew I wanted to do something with healthcare. I didn't know exactly what, so I took a year off, and then I was exploring my options and seeing one of my mentors, if you want, in nursing. He finished nursing like Diana is doing right now, being through nursing and then going back and tell me about nursing and how this is just an amazing career. I didn't think twice. I knew that was my calling, and I jumped in, got my degree, and started my nursing in Lebanon, in an ICU, and like Diana, as a critical nurse. It's very challenging and rewarding. Then went to Saudi Arabia for a trauma center. I worked there for 4 years, and then came to the States. Hopkins, worked there in the progressive care unit, then jumped into an ICU, a neuro ICU. And then there I was trying to kind of all right, what's my next step? And through that, my career, I was precepting, teaching the new team members on the team, and just it's so rewarding. So rewarding from my patients, rewarding from my teammates, and really mentoring as being mentored myself, mentoring, paying back to the new team members, became a charge nurse, and then what's that? That's my entry to leadership, and then I started doing my master's degree, and that's with the MSN. I did it's a joint degree, it's like an MSN MBA program for 5 years, and then through the process, I did a lot of certifications. All that always the student mindset. So here is the CCR and K. The CCR is the critical care. Obviously, the K is the supervisory when you're not providing direct care. So that's a way to keep your certification as a critical care nurse. And then I have it's not there, and I have my NEA-BC, which is a Nurse Executive Board Certified Advanced. It's in leadership as another certification. And the Lean Six Sigma Green Belt certification is another performance improvement. It's just that mindset of always learning, and that's what healthcare, that's what my calling, that I believe is always improving. And I'm sure Diana is going to speak to that as well.
So that's really great. Like you just said something that was so perfect, is that, always having that learning mindset, because, you have so much experience. Does not seem like you've been on this earth very long. So, I mean, you obviously have just, like you said, kept up with, that being a continuous learner. And so I think that's really great. So can you tell us a little bit more about like that, kind of that academic preparation that also helped you out? I mean, and did you, were there ever times where you thought, I want to help people, however, what do I need to, like, maybe you didn't get that one grade that you thought, and you thought, oh, well, now I can't continue on, or maybe you did, and you were like, I'm just going to keep going. But kind of, tell us a little bit about your academic and kind of personal preparation that you went through.
Yeah, it's an interesting question. Yes, I mean, from academia, I think it's more. A lot of it is self initiatives that you're always learning. I mean, pulling articles and always updating yourself with what's changes. And I think it's a cliche to say in healthcare, the one constant is really change. In healthcare, I mean, we know the last 2 years we had a front row seat in dealing with the pandemic and all the changes. We did, so always working to. Sorry, that's my CEO. I'll call him later.
I mean, you could FaceTime your CO and they could be on here too. Awesome.
You'll do right.
Always, and it's perfect that you said always working. Are you sure you didn't plan that one?
No, that's real. So no, you're right. Always kind of learning. I think the first couple of years, I spent a lot of time in the library, just picking up on things that kind of like educate myself and learn. Total immersion is really my go-to to be able to prepare yourself, because I know school it gets you what you need to know, but that's when really the learning starts, right? That when you go at the bedside and you see things that you don't know, you don't understand. Sometimes you do, but you need a refresher. So you go back and really pull that up and just asking and just being humble enough to be able to ask. And I think maybe Diana probably is know exactly what I'm talking about. Is the one thing that is so important for me to not have that ego, to not go and ask and learn and always learn new things, because eventually it's by patients' lives in my care. So that's the one thing. It's a constant academic, if you want to talk about it, but it's really that student mindset and always growth mindset, and just going to different programs and always seeking that knowledge, whatever that is. Is it a degree? Is it certification? Is it an article that you need to read and share with your team members? So yeah, to your question, Tiffany, there's always tough times. And I'm always a believer. It's like, it always makes me stronger, makes you stronger, having these challenges. And being able to, you're never alone. You're always within your peers that you work. You always have that support and resource and pull your resources. And it's key to keep these connections with your peers, with your instructors. You always go back and ask them, and they're the experts, right? And it's so humbling when my instructor will call me and ask me, it's like, hey, yeah, what are you dealing with this? And it's just the best feeling ever. It's very rewarding.
That's awesome. One of the things that you mentioned was asking questions and, kind of having that growth mindset. Talking about how you got into management, how did you really prepare to go into management? And, or were you asking other people like your mentors, questions? And is that what helped you say, hey, I think I want to go into the more of a management track and then get involved that way?
I'll tell you at the beginning, it's like this, not even a question that I would go in management or leadership. It wasn't even a thing. I was like really enjoy taking care of my patients. That was very where I was giver, like I'm a giver. And I have in my 2 patient assignments in ICU, or I have in my 4 or 5 patient assignments in the med-surg tele floor. It was rewarding enough from a patient and family perspective until kind of like start recepting. It's like, okay, I love teaching. I love teaching as well. And then, having a charge nurse role, like, all right, so you're leading that unit and you're managing the flow, you're managing staffing and a lot of that. And that's where, it clicked to me. It's like, all right, I was able to have a bigger impact. And being a charge nurse, and then maybe I need to be a supervisor. I did a nurse supervisor, and what an amazing experience! Like having that operational perspective of a hospital during off hours. It's just an amazing experience. And then being a manager on a unit, and then really building the team up. And really providing that, like, managing the patient experience aspect, or patient safety and quality. How do you grow your nurses? And just it's a natural progression, I felt. And just being now director over 12 units, inpatient, outpatient, respiratory department. It's just the puzzle keeps growing. And again, I think just being humble enough to always learn and know when, and just say, it's like, I don't know, but I'll find out.
Excellent. Excellent. So kind of thinking about that humbling experience, and I don't know, how do you stay excited about the industry, and especially during change? And obviously we all know that what we've gone through the last almost 2 years. So, whether you're using that example or something from the past, how do you stay excited about the industry during change?
I think it's really the impact that you have is that when I meet a patient family, when I meet a family member of a husband of one of the leaders that I have, and say, it's like, hey, her experience is changed our life. Or meet a patient who had a stroke, and because we gave him TPA, which is really the blood declotting medication, being able to reverse the symptoms and being able to, within hours, being able to be reversed to normal, and seeing that miracle. I mean, we're at an age that it's just amazing to be in healthcare. Just seeing these miracles in front of you, we're able to kind of take him to IR and just declot, pull that clot, and really kind of see him reverse back to the normal selves. Managing heart failure, some of these chronic diseases, and being able to help guide them through the process and teach them and educate them. I mean, where do you stop? I mean, it's such a rewarding experience. All over.
Excellent.
Yeah.
And I know you kind of talked about some challenges earlier, so if there's anything else you wanted to add, but also I think one thing that, we do want to ask is, typically the nursing industry has a higher percentage of individuals who would identify as female. Mm. And you being someone who I guess we're saying you identify as male, are the minority then in that particular field. So what was that experience like, as far as maybe a challenge, or maybe it wasn't a challenge, but did you ever feel different, or, think, I got to prove myself a little bit more because, like, there's, everyone else and then there's me? Did you experience any of that? throughout your
Yeah,
training?
absolutely. Absolutely. Uh, I think so. In my family, I have four sisters and myself. So always kind of like my professional life mimicked my personal life, and
That's
it was
awesome.
it was not a lot of change. And I'll tell you, my teammates and peers, they were like so embracing and welcoming, and you know, I didn't even feel that like been challenged. On the contrary, I was like so welcomed. I did see, you know, sometimes, and it's either provider or bias or a patient family bias, and just being kind of like, you know, situations where there's a safety situation that would require um, um, you know, a male presence. So you know, I would obviously offer myself, and the other way around, when I lean on my teammates, female teammates, where there's like, let's say there's a Foley catheter that needs to be placed in, it's like, you know, hey, you know, Gwen, can you do this for me, and I'll take care of your medication or whatever. You know, so it's always a partnership, and that's what's amazing. I mean, I know it's a cliche saying healthcare is nursing specifically is a team sport. Is so true. I mean, you're never by yourself, and it's more collaborative and partnership. We complement each other instead of just like being a challenging.
Excellent.
Yeah.
Excellent.
If you ask me anything else, Tiffany, I
I
think.
know, right? I'm just getting them all right. So what, I guess one final kind of question here, and then anything else you'd like to share, because, you know, I know that you have a tight schedule as well today, but but what advice would you have for individuals interested in going into, you know, healthcare or nursing? And then any other advice or anything else you'd wanted to share that we didn't get to talk about?
Yeah, I think your first part of the question, the original question was challenges, what challenges in healthcare and in nursing, and it's really in a very challenging time. And with that said, it's so exciting times. I mean, with challenge comes excitement, comes thinking outside the box, comes thinking like the norm does not work. Let's be creative. And I'll give you an example. Like, you know, at the beginning of COVID, like having a pump and being able to titrate drips, and we have to kind of like pull these pumps outside the rooms and make extension tubes. One simple example of some of the challenges that we had to work through, but it's again, it's with these challenges comes a reward and a satisfaction that you're able to work through it with a very smart group of people. Advice is understand your why, you know, why you're getting into healthcare. In nursing specifically, it's if you're a giver, if you care about people, you want to help people, this is definitely the career for you, and the sky's the limit with what you can do with it, advancing forward. So that's my tips.
Excellent, excellent. And is there anything else that you wanted to share that you thought we might ask you, or that you want to make sure that you share?
No, I'm so curious to hear Diana's experience as well, and no, I'm good. Thank you so much. I appreciate it.
Awesome. Thank you. So if you all have questions, you know, while we're going on to hear a little bit from Diana here, you know, please feel free to type questions in the chat, and we will go from there. So I'm going to see if I can do this pinning and spotlighting and all of that great stuff as we transition. So Diana, give me just a moment here to do so. And Nikki, I feel like you're going to have to help me out because we are going through the same thing that we dealt with last time. Nikki, are you able to help me spotlight Diana? If you can pin her on her little 3 dots over there, it should give you the option. If not, when she speaks, it'll show up. Okay, awesome. I can't see that, so I'll just kind of keep talking here. And so we'll use our back end like we did last week, Nikki. If there's any messaging that you need to do, I'll have that available to look at. So Diana, thank you for joining us. And we'll just kind of jump right in, Diana. So tell us about your experiences, the jobs that you've had, because I know that you know, didn't just have your Nova experience and then go right into nursing, but you've had some other experiences. But just tell us a little bit about that, because it's pretty awesome that you started out doing office work in a medical office, and now you are a nurse.
Yeah, so Well, that job started because I was at the Career Center at my high school, and at the time, a doctor's office called in asking for a student who'd be willing to come in and interview for a filing job, and I just happened to be in the room at the time. And as soon as I met with them, they onboarded me, and that's how my first job in healthcare started. From there, I actually have a pretty extensive history. From there, nothing exciting though. I moved to Norfolk to go to ODU. This was in like 2008. And I had this expectation that I was going to be like a cell biologist, and that didn't work out. I mainly did it to move out of my parents' house. I did not want to live with my parents anymore. So I had this idea that I was going to move into a town I knew nothing about. I had been sheltered my entire life. And I was venturing to the world, trying to go to college and get my own place and be, my own person. And I thought I could do it all on my own. And from there, my first year at ODU didn't go well, as you would expect. And I ended up staying in Norfolk for like 2.5 years. And there I decided to go to Everest College to become a medical assistant because I was so determined not to go back home and I was going to make it on my own. And through that, I got a job at the medical school down there. It's EVMS, as a scheduler for maternal fetal medicine. I did that for about 6 months before I got my job at Inova as a medical assistant, because that's where I went to Everest for. And I moved back up to the area and stayed with them for about 10 years as a medical assistant. I did floating. I was part of the float pool. I covered primary care offices, specialties, and I, for a while, was with an arrhythmia group where I learned a lot of electrophysiology. It was a great learning experience then. From there, I got into nursing school, and after graduation, I was offered a position on the ICU at Reston Hospital. And that's pretty much the watered down version of it all. I know it's like pretty like, yeah, but anyways, so that being said, that wasn't exactly how I planned my life to be when I graduated high school. Matter of fact, I wanted to be a physician my entire life, just like my father. My father's a physician in El Salvador. And I was very interested in maths and sciences. But life happens. I can't tell my story without bringing up the fact that I had my first child when I was 16 years old. So a lot of my journey was based off of trying to be an adult, more like a child, trying to learn how to be an adult in the adult world. And I think every decision I made was with the intention of upward mobility, so I'd have stability in my life. Eventually that was achieved, but I mean, one of the things I learned along the way was you can't really make it on your own. You need support. To have a strong supportive system is very important, especially if you want to succeed, because there will be times where you're going to rag on yourself so hard, like you can't pick yourself up off the ground, and you'll need those people around you who can remind you that, things are not as bad as you think they are. You can still keep going. There is light at the end of the tunnel. And sorry, that was my really long story about my career.
Oh, thank you very much for sharing. So what did you enjoy most about your NOVA experience and classes that helped you in your field?
So what I really enjoyed was the social aspect of my experience at Nova, especially because in community college you'll meet people who are not in the traditional, student role. Like myself, I wouldn't consider myself a traditional student by any means, and to know that there are other people there and to share and relate, and like nursing school for all of us was a new experience. We were all going through it together, but we all had our own piece of, our side of reality to say, like, this is what life was like for me. This is what experience I have that I can apply to, nursing or life in general.
Mhm.
And it was also really, for me anyways, it was really refreshing to see young people too, because when I reflect back on myself at their age, it's just a humbling reminder that, like, for me, it is incredibly impressive to see people like 20-year-olds, 18-year-olds, 19-year-olds going into nursing and already knowing what they want to do. It's like, wow, I couldn't have figured that out at that age. Like that, I was a hot mess back then. So it was really good to see people's faces and like, go through the whole nursing experience, like through the blood, sweat, and tears of nursing school. It's really comforting to have like, brothers and sisters in solidarity.
Yes, thank you. So what type of personal and academic preparation helped you the most along the way?
So for me, I think what helped get me into nursing school was the fact that I had been trying to get into nursing school for like 10 years.
Mhm.
So I like completed all my prereqs, all my non-nursing courses. I got anatomy, physiology, microbiome. I got all of those out of the way. And I think that gave me a competitive edge in the application process. I also, I noticed a lot of people in my cohort who were younger than me. They felt like they were running out of time and they had to do things within a certain time period. And to like loosen up those expectations did help a lot. Knowing that, you will get things done in the time that you will get them done, regardless of what deadlines you set for yourself, it'll happen. And so keeping that in mind did help me a lot. I stopped caring about like how old I was, how late I am in the game, because I mean there was a woman who is retiree age, and nursing was her second career, and she was doing it, and it's like, well, what am I complaining about? It's like she's doing it very late in life, and this is a choice she's making, and I mean she did it. She came out at the top of the class. But yeah, I think setting realistic expectations for yourself,
Mhm.
setting SMART goals. I talked to a lot of students who, after I graduated, asked me for advice. And I think the biggest advice I could give them was just to give themselves time and just be easy on themselves. Like, it doesn't have to be done in the time frame you think it does. Like people, I'm gonna steal words from Tony Robinson. People often overestimate what they can do in a year, but they often underestimate what they can do in 2 years.
Very good. Now, what shift do you work and how do you balance that personally and professionally?
So currently I work night shift. Night shift is great for gaining like a routine and getting your sea legs, because day shift can be very chaotic. There's people in and out constantly. You have these goals of care that you have in mind to set up at the beginning of the shift, and then things can easily get derailed because imaging needs to be done, blood work needs to be done, OT, PT, consultations, anything can happen at any point, especially in the ICU. People are so critically ill that they need your individual attention. And you have to be constantly vigilant, constantly be paying attention to what's happening to your person. And at night, that's not necessarily the case, not always anyways. People tend to operate during business hours. And so it's more like, okay, now your person is sick. Now make sure all your nursing care is taken care of, and also keep an eye and make sure your person stays alive, like I like to think of I like to imagine a little man turning knobs at a boiler, it's like, that's pretty much what it's like managing a critically ill person. And I am really new to this. So I'm pretty sure my perception of it now is going to change differently, or it's going to be vastly different in the future. But yeah, it's pretty much, I think for me anyways, I would like to get my balance before I get tossed into the ocean full of sharks, and fend for myself.
That makes sense. Is there anything else that you would like to share?
No, unless somebody has questions for me. Oh, actually, yeah, I do. I think this is really important, and I think everybody should hear it at some point in their life, that you have to love yourself. It is super important to love yourself. You are your worst enemy or your greatest ally. And you want to be on your side 100% of this. If you want to go into nursing, if you want to go into healthcare, know that you can do it, but you have to be kind to yourself and take care of yourself, because that you are going to run yourself ragged into the ground if you don't.
Thank you very much for sharing your experience and that great advice. It's so true that we do need to take care of ourselves, and in order to do our best in our field, we have to put our best foot forward.
Awesome. So thank you so much, Diana, for sharing. And thank you, Nikki, for we tag team, just so you all know. We may tag team again before our time is up here. But next up, we are going to hear from Kimberly Nicely here at NOVA to talk about our programs. And Kimberly, I can just advance the screen for you. Does that work?
Yeah, that's fine.
Awesome.
That's fine.
Just let me know when I need to click on something else.
Wow, what a wonderful story, Diana. You're a typical student that we see daily. But today I'm here to tell you about how you can get into these programs. A lot of times when students are preparing to go away to college, they don't look at the community college as their first glance. They want to go away to the university, as Diane mentioned, to get away from parents or whatever the circumstance may be. But I'm here to tell you that looking at the community college first would probably surprise you, and in such a way that you're like, I didn't know. Currently, NOVA has 10+1 Associate of Applied Science degree. And you're probably saying, why is she saying that +1? Well, the reason for that +1 is because one of the programs that we do offer here at the medical campus here at NOVA belongs to our sister school, is at Virginia Western Community College. And that's our radiation oncology program. It's taught here on our campus, but yet your degree comes from Virginia Western. But the degrees that we do offer here is diagnostic medical sonography, dental hygiene, emergency medical services, health information management, medical laboratory technology, nursing, occupational therapy assistant, physical therapist assistant, radiography, and respiratory therapy. Now, all these you say, oh, wow, yeah, I can go away to the university and I can be far ahead by going to the university. Well, let me tell you what happens a lot of times. A lot of times students go away to the university, and when they go to the university, they don't realize that their first 2 years is of general studies. Before you can even apply for your major, they're going to require you to do at least 2 years of studies before you can apply to your school, whichever school you want to attend. I'll give you a story, for example. My daughter, when she graduated high school, what ended up happening, she ended up graduating at the age of 17. She wanted to go away, just like any typical student, when they get to high school, they want to go away to school. So what she chose, she knew she wanted to go into medical. So I'm sitting there on the edge of my seat, okay, she's going to call something that Nova offers, but she didn't. She said nuclear medicine. We don't offer a nuke med program. We didn't even offer radiation oncology at the time. So then what ended up happening for her is that she goes away and she finds out that she has to do those 2 years of study before she can apply to the School of Radiation Science. So she got accepted at VCU. So when she gets there, she does that. To make a long story short, at the university level, they don't take in as many students as we would at the community college level. So she applied for the new school to go to nuke med under radiation science, but she wasn't accepted because they only took in 3 students that year. And she was not the top 3 students. So then she had to think, okay, what else can I do? What other program can I go into that will fall in line with what I want to do? And she ended up going into the radiography program, okay? Yeah, guess who has a radiography program? Nova has. But I can tell you that by the time she got ready to graduate, which the December before she graduated, she calls me and she says, Mom, do you realize I'm taking the same exam your students are taking at Nova? And I said, yes. Then she said, do you realize I'm competing for the same job? And I said, yes. So the thing is that you don't always have to go to the university to start out with to get what you need. You could always start here at the community college. A lot of people don't realize that we have these programs or that we even have a medical campus that's located in Springfield. But we're here for students, and all of our programs, all our degree programs are competitive. As Diane mentioned, that she had to make sure that she had the prerequisite courses done. She had to make sure that she did those co-requisites as well, because that plays into the competitive admission of a lot of these programs. The outcome of getting into these programs is licensure. Everybody wants to go through school and be able to sit for the exam. That's the key. And yes, there's going to be challenges. A lot of times people think because it's a community college that the course content is watered down. That's not the case, because we have to prepare you for that NCLEX exam if you're going into nursing. So you have to pass that exam to get the license. So if you went to Nova and you went through our nursing program and you passed the NCLEX exam, you are RN. You are RN. And so now what can happen is, okay, you can leave Nova and you can transfer out just like Diane did, and she's at UVA. So there is a track for you to transfer out with some of these courses, not all of them, because some of the programs, the highest you can go is at a bachelor's level. And then what happens at that bachelor's level, you end up with, you did the license. So when you go back to get your bachelor's degree, it may be in health administration because you're already licensed in the field. So the nursing program is transferable. The thing that we tell students, and Diane probably knows this, is that when she went through the program, they wanted to make sure she had a general studies degree. They also wanted to make sure she had the nursing degree as well. Because what that does for you is keep you from having to take those courses when you transfer to the university. So you're not paying that high cost to take a STAT course. You're not paying that high cost to take any of those additional courses that the university would have you take in order to enter into their program. One thing about transferring as well also is that once you transfer and you become a student of that university, they won't allow you to come back to Nova and take any classes and transfer them back. You got to get special permission. So the thing is that start at Nova and finish your program here at Nova and then transfer out. Because what ends up happening when you transfer into a BSN program, majority of them are all going to be online because you don't have any more clinicals or practicums to do. Excuse me. It's just book work. It's just that simple because you had the license when you left and you are in. But these are some of the schools that you can transfer to with completing Nova's degree. You can transfer into George Washington University, Mary Baldwin University, Jefferson College of Health, BCU, George Mason, American Public University, Western Governors University, Grand Canyon University, and you can also do UVA as well. I can tell you by the time, and Diane could probably vouch for this, is that as you transition into your final semester, we have colleges here that are looking for students to make that transition. We have a college fair where they're just waiting for the students to sign and say, hey, and sometimes you can be dual enrolled. You could be in your last semester of classes and then transition into the university without missing a beat. I like to tell students, once you're RN, you're RN. You can go out and work and get the experience, and then let the institution that hired you send you back to school to get that BSN and that MSN. Why should you have to pay for it? Because they have educational benefits at whatever facility hires you. There's educational benefits for you to continue your education. The prerequisite courses, let me tell you this, the Northern Virginia Community College has what we call a VCCS common curriculum for our nursing program. And what that means is that we have a lot of military service people that come and go, that get stationed here in the Northern Virginia area, coming up from Tidewater, or they may go down to Tidewater or whatever. So any school within the VCCS system, if they got orders, the spouse got orders to leave, they can up and transition into another school and not miss a beat and continue on with their education. This wasn't around when Diane went through her program, but this is the new common curricula that allows the students the flexibility, because we have the military that's here that up and move around within the state. The nursing program have 2 entry dates. They have a August start date, and in order for you to apply for August, you have to have your application in by March 15th. We also have a January start date. Those that are applying in January have to have their application in by September 15th. I can tell you, since COVID, our numbers of applications have more than tripled. People want to be a nurse. And I guess that's because they realize that during times of crisis and health situations, that nurses are always going to be employed. And so right now, like, we just closed the window for application period. We had 657 students apply. And the nursing program is only going to accept 100 of those students. So it's going to be the top 100 that get accepted into the program. And so I can tell you that the college, Nova, along with the health community and so forth, there's a need for nurses. There's a big drive for nurses. We just got approved for $25 million to expand a new building here on this campus so that we can take in more students. And so we're growing the program. And I would say pre-COVID, we only would have one cycle going through. But since COVID, we've been having 2 classes come through to get enough students into the program. The students that took the NCLEX, I would say in May or June, the pass rate was 94.86. It was the pass rate for those students. And so we're training them. We're making sure they have the education and the skills needed to go out there and work. The thing is that the program is competitive. One thing that I didn't put on here that I should put on here is that not only do you need the prerequisite courses this time, you're also asked to take the TEAS exam. And the TEAS exam is an exam that tests students' ability to read, to write, to do math, and just to make sure that their skill sets are there so that they can manage the program. Any questions?
What was that exam, Kimberly? I can add that onto the slide because I have to do an edit before I send out.
Okay, it's TEAS, ATI-TEAS, T-E-A-S.
ATI-T.
T-E-A-S.
Okay, I'll add that on there for you.
Yeah,
I
they
think
have to take that. And I recommend that students also view the nursing's website and the brochure and the handouts that's there, because it'll spell it all out for them and it'll tell them what scores they have to have in each of the areas, because there's 4 components.
excellent. And I think Nikki has a question. Then I know that we have a participant that has a question.
Yeah. Okay, go ahead. What's your question?
So there was a question of if a transcript was needed to apply.
Pardon that, pardon me?
If transcripts were needed to apply.
When you say transcript, are you referring to college or high school?
High school.
High school, yes. Nursing requires, well, I would say B-Bond requires that we have proof that you graduated high school. We have to have it on file. Yeah.
Okay.
I see Frankie, you have a question?
I do. Yes, ma'am. Good afternoon. A quick question for you. I talked to one of the counselors there, and I wanted to understand kind of the school's philosophy on the TIAS, because what I was told is it doubled and tripled because people didn't have to take the TIAS.
Right.
So therefore, you got a lot more applicants because that's one less thing they have to do.
Yeah.
Now, going forward, for the rest of us now have to take the TIAS, we're also now competing with people who didn't. How's that going to be for the next couple of years? Is that going to go back to no TIAS, or is it going to stick this way, or what's the philosophy on that?
It's going to stick. And the reason why is because before we had a way of testing the students by the math placement and the English placement. We no longer do that anymore. If we can look at a student's high school transcript and see that they've had a certain level of math, they could jump into a math class as long as it's not analytical calculus or anything like that, high order. So that piece was taken away as well. But the TEAS is a way for them to monitor the skill set. Since the math and English placement has gone, they need a way to make sure that the student has the skill set in the math, the English, the reading comprehension. They need to make sure that the student can be successful in the program. And so when you apply, if you're planning on applying the next cycle, all those students will be required to have the TEAS to be eligible.
Thank you.
Question?
There was another question in the chat of during high school, what classes should we take if we want to join the nursing at Nova?
We oftentimes tell students science is always key. If you can get into anatomy or physiology course, that's good. But we also want you to look at taking biology, taking chemistry. Because if you look at the nursing requirements, it will say high school bio or high school chemistry. Those are part of the prerequisites that's needed. If you don't take them in high school, that's additional courses that you got to add to the college
Mhm.
courses that you have to take. So, but if you take them in high school, and algebra is another course. If you can take algebra, you're good as well.
Very good. And does Nova process loans or offer FAFSA?
Yes, we do. You can apply for financial aid. Yes, you can.
Another question came in. What are things that people can do to try and help their chances of getting in, i.e. volunteering or community service in the healthcare fields, etc.?
At this point, they totally look at academics.
Okay.
And so the better to apply, they say C grade or higher. We can tell you in a competitive program, if you're coming in with all C's and somebody else is coming in with all A's, they're going to beat you out every time. So the thing is that you want to come in with your A game. You want to come in with those A's because those are what's going to make or break you in the program.
Okay. Are there any additional questions? Does CNA make you more competitive when your grades are competitive?
Not at this point, but nursing was talking about in the future, maybe looking at if someone was credentialed as a CNA or MA. So they were looking at that, but at this point right now, they're not looking at it. It's strictly academics at this point in that KEYS exam.
The next question, will I get help getting a job as an MA, just like Diane while attending?
Well, you will get a job. Let me tell you, a lot of our students, and this is the way I tell students to look at things. When you're going through our program, you have your lectures, you have your labs, and you have your clinicals. Treat your clinicals like an interview. You're interviewing that facility to see if that's where you really want to be, and they're interviewing you. And if they really like you, they can offer you a part-time job as a clinical tech while you're going through the program. So the thing is that you always want to think of it as a job interview, not just a clinical. And I always tell students this because they seem to forget this piece. Just because you see other people there sitting around laughing and joking, that's a test to see if you're going to fall into that. Because they don't want someone that's going to come in and just sit and laugh and talk. It's okay if you do that, but they're going to say, oh, no, when this patient needs to be taken care of, everybody's sitting around. So we oftentimes encourage students that when they're doing that, go and say, hey, I see patient such and such needs something. I'm gonna go over there and I'm gonna check on them to make sure they're okay. And you know, keep yourself busy, not just sitting around doing nothing. Always ask, what can I do? Is there anything that I can do? That's the advice that I give to all students. Look at it as a job interview.
Very good, thank you. Frankie, I see you have your hand up.
Yes, ma'am. Will the COVID vaccination be required for entrance into the nursing program?
It's for it. If you get accepted, it's going to be required of the facility. The program may not require you, but the hospital that they send you to will require it.
Okay.
So,
thank you.
Are the facilities for the nursing program open, or are they still online classes?
Oh no, we never shut down. The health science and nursing programs never shut down, because in order for you to sit for licensure, you got to have so many lab hours, you got to have so many clinical hours and so forth. And so we were open.
Okay.
We ran our labs late in the evening just to have the distance that was needed. But no, we were up and running. We had to, because those students were already in the pipeline and we had to get them graduated.
Okay. Which colleges outside of Nova and the VCC system offer a nursing degree? If students can't earn a spot at Nova, what options do they have at other at other parts of the state? Do these programs have the same requirements as Nova?
Now, all the schools within the VCCS, which means the Virginia Community College System, will have the same requirements.
Mhm.
But outside of that, you got to be very careful when you're looking at other schools that are not the university level, because there are for-profit schools that you can attend, and you have to do your homework. You have to make sure that you're getting what you pay for. You know, can I sit for my licensure? What's the pass rate of that NCLEX exam? You want to do your homework before you commit to that institution.
Okay.
Can I chime in on that too? As
Mhm.
someone who's been to a for-profit school, those schools are extremely expensive. A lot of the times they tend to be predatory. They'll give you the promises that there's flexibility with work hours and night classes and weekend rotations. And they'll give you a lot of promises to get your foot in the door. And a lot of the times they'll say yes to your application. It's not usually competitive to get into these nursing schools, but bear in mind that the commitment is extreme and the financial commitment is it's very burdensome. I always advise against for-profit schools and to always go for community colleges or public schools. These for-profit schools are in the business of making money and not necessarily in the best interest. Sure, they want to get you a degree because they're accepting government money, but at the end of the day, they're getting your money and you're on the hook for it.
And
Come off my soapbox now.
thank you, Diane. That is so true. So that's why I say do your homework. Don't jump right in because they accept you. Do your homework. Because as Diane said, they're going to charge you this large amount of money to attend. When you go back and you look at what Nova charges you, you'll find out that it's much cheaper to come to Nova. And we get that a lot too. We get that a lot where students will go away to the university, and then when they go to apply, they don't get accepted. Then they come back to Nova and go through Nova's program and then transfer back out. So we get that quite a bit.
And to add to that, it is very possible to go to nursing school for free. I did it. I got my entire nursing schooling through scholarships and grants.
Yep.
Just put in a FAFSA application, and I was able to get into UVA with a $10,000 grant scholarship, and I won't owe anything for my bachelor's. So I'll be doing that entire experience for free.
Yeah,
That's great.
yeah. There's a lot of scholarships, unclaimed money for the health sciences and nursing programs. That student is just getting the students to, you know, apply for it.
Next question, as an international student, what requirements do you have to accomplish? Do we have to present an international English exam, transcripts of study, anything like that?
Well, the international students will pretty much have to come in the same way that, you know, any student comes in. They have to meet the requirements of the program. The thing, what separates an international student depends on their domicile status, whether they're F1 visa or whether they're a permanent resident. There's a lot of factors that go into a student when you say international. So it's a case by case when you look at an international student, because you have to know the background. You have to know what they're bringing in with them in order to determine whether they can be accepted into the nursing program.
Okay. What types of classes boost your nursing application? I think you talked about that a little bit before.
Yeah, I can tell you the sciences do. Science is key. And it's not a matter of getting into a science class and just memorizing it for the moment and then dumping it. That information you have to hold on to, because as soon as you're in your first nursing class, they don't have time to teach you anatomy and physiology or microbiology. Again, that's not what they're there for. They're there to teach you and train you on how to be a nurse. And so if they're spending all that time teaching you anatomy and physiology, they can't move forward. So the thing is, I can tell you that most of the weight is in the sciences.
Okay.
They weigh very heavily on the sciences.
The schedule for the nursing program, is it every day or how is that structured?
Diane, how often did you go through the program?
It varied with each semester. I remember my first semester, I had about 5 courses, so it'd be like 3 classes a week plus 1 clinical. And then as the semesters went along, it'd be fewer classes, like meeting twice synchronously on Zoom, and then clinicals would be like twice a week. So it depends, and I will say that it does require a great degree of flexibility. Flexibility was the key word our entire program, because the schedule was constantly changing. So you need like reliable transportation, childcare, a very flexible job, because those days will change at any moment.
Thank you.